quite a pleasure.
Hello, Petronille. My name is Jürgen Thiel, and I'm head of research coordination, and I will give just some remarks on the organizational part.
Wonderful. Thank you, Jürgen.
Okay, so now it's 4:00 p.m. Hello and good afternoon, everybody. My name is Jürgen Thiel. I'm head of research coordination at the Robert Koch Institute, and I want to welcome everybody to today's lecture within our Robert Koch Colloquium. Before I hand over to Dr. Ziese for some welcoming words for today's speaker, one further information. For the ones who are following our lecture on WebEx, you can ask your questions at the end of the presentation in the chat. Please address your questions to the host and the moderator. And if you are watching from our live stream on YouTube, please send us your questions on the email address rkc@rki.de, and you will find that address also in the info box below. That's all from my side, and I would like to hand over to Dr. Ziese. Thank you.
Yes, hello everybody, and a special hello to Petronille. I'm glad that you're here and giving a talk today. A couple of minutes ago, I've been informed that President Wieler and the Vice President Lars Schade unfortunately cannot attend today due to other unexpected meetings, but which I regret. But for me as a person, it's quite a pleasure to welcome Petronille here, as we are cooperating for a couple of years now in different settings. So, Public Health Surveillance Information is the title of the talk this afternoon. Petronille Bogaert is the head of the unit EU Health Information System at Sciensano, the National Public Health Institute of Belgium. At Sciensano, Petronille leads a scientific multidisciplinary team in successfully performing 6 European projects in health information. First, it's the one we are involved in as well, the Population Health Information Research Infrastructure, FIRI, different pronunciations are in the room, a project that facilitates research through the sharing of cross-country COVID-19 population health information and expertise across Europe. Next project she's coordinating is TEDAS, the joint action towards European health data space, as well as a healthy cloud. Another project closely related to FIRI is INFACT, together with Uncover and AGAs. These are activities that include identifying secondary health data, sharing practices across the European Union, capturing European data collections available for research purposes, and setting up a European health information web portal. Those projects happen to be the main projects dealing with public health data on the European level. In other words, Petronille is the leading person in this area of the public health world within the Union. Since last year, Petronille is president of the UFA section Public Health Monitoring and Reporting, a section that aims to establish a platform for the exchange of experiences and good practice examples of public health monitoring and reporting. The section's field of interest are monitoring models, indicators for public health monitoring, and the underlying data. It includes reporting of outcomes to public health monitoring and includes forecast, as well as the evaluation of impact of reporting. It's quite an impressive area of activities of Petronille, and I'm looking forward to your presentation. Welcome again, Petronille.
Thank you so much, Thomas. These are very kind words. All right, so if you give me the opportunity to share my screen, yes, perfect. Then I can go ahead and start with my presentation. I think I had a really nice introduction from you, so here we go. All right. Oh. So indeed, I work at Sciensano, which is basically the Robert Koch counterpart in Belgium, so the Public Health Institute. And yes, what we've been working on in the past 6 years is European projects in health information. So I think Thomas has very nicely summarized them. But I think for this presentation, I want to focus a bit more on some of the lessons learned we've had with compared to public health surveillance and health information, and what health information means and health information systems mean, because I think it would be very relevant for many of you. Oh, apologize. I see that you're seeing the wrong screen. Let me stop that and change that. Apologies.
Thank you, Petronille. Very nice.
Sorry. There we go. Now you should be seeing the good screen. So yes, I'd be very happy to talk a bit more of like our experiences, our lessons learned, and how that can be of help to each of you working in the Robert Koch Institute. So that being said, what are the topics I'm going to cover today? Well, I'm going to be talking about what is a health information system, and I'm sure many of you have an idea what it is, but it might be good to have some other perspectives and some different views on how it can be interpreted, because I don't think there's just one single definition for it. Then I want to share some of the European tools that are around and at your disposal, which might be helpful for your work at Robert Koch Institute, and also, share some of these useful tools. And then I want to stop shortly on what are some of the common enablers and barriers that we see across Europe in health information systems, which are most probably also very relevant for the Robert Koch Institute. And then I will go to these major strategic initiatives that are happening at the moment in health information. And if time permits, so I'll be keeping my eye a bit on the clock, I also just want to share a couple of slides on Infodemic, because I think it's an upcoming area that is relevant to all of us working in health. All right, so my first topic is, what is a health information system? And why did I bring that up as a topic? That is because depending in which area you work, you might have a completely different view on what a health information system is. You might think, oh, it's an electronic health record system, so it's an e-health system. Or no, it focuses on hospital records, or it's the digital platform in which you exchange with patients information, or does it encompass the health promotion or the digital health aspects? And I think many of us have a different view on that, depending in which area we work. What's also really important is that health information systems really vary across Europe, and depending on what has been the historical context, the cultural context, or the governance context, these different health information systems have evolved very differently, and all of the health information systems really have their uniqueness, I would say. And then what is also quite specific about health information systems is health information is regulated and accessed by Eurostat for a specific set of areas. So that makes health information quite unique in its operation. So when you think about a health information system, most of the people actually think about data and it being refined only to data. So a health information system is actually much larger than that, and it involves many different steps, which a lot of you will be are probably involved with. So you have what is coming from the data having to be translated into information and to knowledge and wisdom. Because obviously you have a lot of information in that data, but it needs to be translated before it can be used for policymaking, but also in any research aspects. So this information pyramid actually shows all the different areas that are involved in bringing data up until wisdom, and how you have different actors that play a role in each of these individual steps. But again, it's not only refined to having data, information, knowledge, and then knowledge extracted, information, knowledge, and then the wisdom that's extracted from that. A health information system, in my opinion, is also all the underlying structures which allow you to be able to do that. So you need for me, what is part of the health information system is also the ICT infrastructure that is part of this chain. It's the legal framework that is part of the chain, the financial resources, and the human resources. And what I would like to add also, which is not on this slide, is all the political framework, because how your health information system will operate is very depending also on how your political governance of your health information system is operating. And also, it's not only about the data or the reports that are produced in all these different areas, but what's really important is the different stakeholders that are involved in the health information system. So as the Robert Koch Institute, you are one of the players. As Sciensano, we're one of the players, but obviously there's a lot of different actors that are involved into having the system work. And having the moment from the data is being collected to actually translating it into policy measures or translating it into specific research activities. What we've done, for example, in the joint action on health information, and I'll be talking a bit more about some of the results of the studies that we've done there, is we went into the countries and we assessed 9 health information systems across Europe, and we interviewed different stakeholders that are part of this chain. And one of the most remarking experiences I've had there, and which was also shared by the participants in doing these assessments, is that very often the different players and the different stakeholders that operate in this chain of health information don't know they're part of this bigger health information system. And so the fact that you bring some awareness of it being a chain and that each member of the chain is actually essential to making the system work really helps in feeling the importance of each of the members in that, let's say, public health surveillance system or health information system. And then also what is really important to know, in our perspective, we use a population health framework. So when we talk for us about a health information system, it's not only about care. It's also, or the healthcare system. It's also about monitoring the health of the population in general. So not only the sick people, but also the health people. And what is important there is that you think about the areas of health status and the areas of determinants of health. But I'm sure many of you are very familiar with this. But for example, when we talk about health status, we talk about the disease status, the functioning and the quality of life, for example. And when you talk about determinants of health, this is really all the aspects that determine the health of a population. What we tend to see also in Sciensano and in other public health institutes is that unfortunately these things are very siloed. So what ends up happening is that in the department somebody works specifically in care or somebody works specifically on health status. And I think it's really important to bring these different areas together. Also when you think about infectious diseases or chronic non-communicable diseases, then it's really important that we understand that these things cross over. And especially with COVID-19, we've seen this. Many of the areas that are not specifically linked to infectious diseases, or COVID-19 is a pure infectious disease, but it has an impact on this entire framework. So it has an impact on the whole population, and it has impact on many other areas, which are not only specific to infectious diseases. So that brings me then to the second part, is what are some of the main sources and tools that are available? And here I wanted to bring this today because what is interesting to see is not only how is my country doing, but how can I see how other countries are doing? How do I compare? And there's a lot of international organizations that have very interesting sources and data sets that you can use in your analysis. So I'm just going to give an overview of some of the ones that I have come across that I think are important, and it could help you in the work that you're doing on a day-to-day basis. So what kind of data sources are important when we think about population health? Well, I think some of the most like known ones are the one in with disease registries, electronic medical records, survey data, claims data, pharmaceutical data, but also more and more there's other ways in which data can be collected and that can be useful in the future. I think just some of the examples are like wearables and devices. And when you think about public health institutes and the type of data that we collect, usually we restrict ourselves to like the main or more historical data sources. But more and more also these other data sources on social media, for example, can play an important role because it can have huge impacts on public health, which I will cover in the last point of my presentation as well. And then one more thing which is important about these data sources, which I am confident that all of you work in a specific area and you know more about probably than I do. But what is important about these data sources is that they don't always represent the same coverage. And if you want to do surveillance, it's really important that you look at the total population and the different types of sources that you can cover for the population as a whole. So then I just wanted to give a short overview of some of the data sources that in Belgium are mostly used. So obviously we have surveys, just like all the other countries, and which is certainly the case as well in the Koch-Institut. Some other really important sources are administrative data. Then you have registers. You have specifically for surveillance data sources, we have performance assessment of the health system and the medical practice variation. So why am I showing you these two slides? Well, because also here you can see it's not always the same organization that is covering the different data sources. And also, all of this are connected and form in the health information system. So just another example, for example, for FinData, here you can find a really nice overview of what different types of sources are available in the country and can be linked to form as a whole the health information system. Then I want to focus a little bit on the European perspective and some of the important tools that you can find there. So the 5 most important organizations with regards to health information across Europe is Eurostat, DG Santé, the Joint Research Center, the WHO, the World Health Organization, and then the Organization for Economic Cooperation and Development, OECD, which many of you are probably familiar with. And I'm just going to shortly touch upon what are some of the resources that are interesting in these dedicated areas. So as you know, Eurostat is one of the most important ones because Eurostat has actual legislation. So a lot of the colleagues in Koch-Institut, but also in Sciensano, are following up on all these different elements that through the legislation need to be provided to Eurostat. So obviously the resources they combine on their portal is a rich source of information. And I think we really have the luxury in Europe because we also have other organizations that are looking at data. And some might say, well, how is it possible that some of the indicators that are showed on Eurostat differ from some of the indicators you can see at the WHO? But actually, I think it's a real richness of having these different areas and these different organizations cover some of the similar domains because it brings a certain perspective which is helpful, I think, in our work. Then you have DG Santé, which works and has a specific portal on the European core health indicators on data. And so these provide public health program funding for developments of various aspects of health information. So a lot of the projects that we are working on actually are under the EU for Health program and are operating in that specific area. And obviously what's also really important is that they collaborate very closely with the OECD and the WHO in some of their activities, which I'll showcase in a minute. So what is relevant for your work probably is when you go to the Eurostat website, sometimes you can get lost and it's very difficult to find the exact information that you're looking for. And we had a few European events that we organized where these different organizations provide some workshops on how you can directly find information that is relevant for you. If you go to the homepage of the Eurostat website, you can actually see they have a dedicated section on population and social conditions where you have health. And what's really nice here is that they don't only have the data set, and this is something most of the people know, that Eurostat has a data set. But what they don't know is that they also have all these other dedicated sections on selected tables, information on the data, publications, the statistics explained area, the methodology, and legislation areas. And these, I find them very useful in some of the work that we do. And so, of course, when you click then on the data set, this is probably the area that is most interesting to you, where you can find here in the corner all the different health data sets. This is the European Core Health Indicator dataset, which we have worked with both in a joint action on health information, but also in Bridge Health on trying to fine-tune what are some of the key indicators that should be prioritized, and also updating them, and also seeing if anything needs to evolve with, for example, COVID-19. Then we have the Joint Research Center. Here also, many colleagues are not aware that they have a specific area where you can find information. So the Joint Research Center works in different areas, but one of them is the European Cancer Information System, which provides information on incidence and mortality estimates, incidence and mortality historical data, and survival estimates. And also the GRC works on rare diseases and other areas. Then, of course, we have the WHO European Health Information Gateway. And I think what's specifically interesting about their portal, if you go to the European Health Information Gateway, is they don't only show the databases, but they also show some of the important monitoring areas that are important probably for some of the work that you're doing. So they're looking at indicator sets, at joint monitoring frameworks, but in terms of monitoring, there's a lot of interesting material there as well. And obviously reporting. There's a huge dedicated section on reporting, which is interesting to look at. And then we have the OECD. They have a dedicated health database. And what's really important in terms of European activities is they publish within the cycle, the State of the Health Initiative, they have the Health at a Glance report, which is a very informative document. And then, of course, these different initiatives work also closely together. So there are joint data collections, for example, for the health accounts and non-monetary healthcare statistics. And then I just want to take 1 second before moving on, is that there are other departments in the Commission that work on health. And some of them have really some huge projects working in the area of health. And sometimes as public health institutes, we also tend to be way less familiar with them. I didn't actually mention them here because, yeah, it's quite extensive, but do take into consideration that DG Connect and that DG RTD, which is the Research and Development Director General of the Commission, are also carrying out activities in public health and in population health. So this is an area where we are trying to get more familiar, specifically in Sciensano and in our unit with, because just like I was explaining previously, we tend to work a bit in silos. And this is also the case at the Commission. So sometimes these different departments in the Commission don't speak to each other, and also operating under one specific DG, for example, the EU for Health program, we tend to know less about some of the Horizon 2020 activities that are ongoing. And I think there is a specific danger for that. One, well, there is some interesting things and information that we miss at European level, but also that we tend to duplicate sometimes activities that are happening at European level. And I think this can be also mirrored in some of the things we do in an institute. When we tend to grow bigger and bigger and bigger, it's very difficult to still get this overview and this oversight. And then, yes, things sometimes become duplicated. For example, some indicators that are collected in the Public Health Institute then are also collected at a statistical offices. Of course, that's not a major issue, but in these challenging times where we're trying to be as efficient with the time and the resources we have, it is good to bring these things together and try to, as much as possible, be efficient with the activities that you do. And so some of the ways in which we're trying to overcome that and to try to help countries deal with these aspects is we, with the projects that we're currently coordinating at European level, are trying to organize national nodes. But basically what they mean is we try to bring the different stakeholders that work in health information together to really make them realize that they're one part of this bigger chain and that it's important that each of the dedicated areas are important. But secondly, also to talk to each other and say, oh, I'm involved with this project at European level, or I'm involved with this specific activity nationally, which may be of interest to you. And it's really about exchanging about that as well, which I think is very important. So then one tool that I wanted to mention to you, which is going to be updated very, very soon, so there's a new version of it that will be published in the upcoming months, is the support tool from the WHO. So what they do here, it's a tool they have developed from A to Z to assess health information systems. So usually what happens is that as a country, if you feel like you would like to see how you can improve your system, you can ask the WHO to come in your country and carry out an assessment of your health information system. And we thought that approach was particularly interesting. And in fact, we've been wanting to also implement some of these assessments. So what we have done is that with InFact, we have slightly modified this WHO tool with approval from the WHO and adapted in a peer review format, meaning that what we did is we had 9 countries participating. We split them in 3 groups, and we had 2 countries assess or go into the 3rd country and assess the system and then actually rotate. And excuse me. And what I thought was really interesting of that exercise is that countries, I thought what they would learn is what, you know, the strengths and weaknesses are, and potentially exchange some of the things I've seen in one country compared to the other. But what was really interesting actually is what happened is I learned much more about how their own system is working. So sometimes what's really interesting is by going to another country, you really get to understand how your own system works and how you can improve your own system. So the fact of doing these assessments in peer review really had a completely different benefit. And also what I thought was really unique about doing this country visit is that in 2 days, we got a complete overview of a health information system and how it works. And I think when you work in a country, in a specific area, in a specific institute, it's difficult to get this complete overview and to know what are the different stakeholders, what are the different elements and different steps in its operation. And by going into the country and by organizing an assessment in your own country, you actually get to see who are all the major players. And what is also really important, and which I think we tend to forget in countries, is usually strategic decisions are made by the directors or the different leaders of each of the institutes. But actually by going and disentangling a little bit these different areas, which I talked about before in the health information system, you can see you can take the people working in that specific area and give them the opportunity to talk a bit about strategy, not only to talk about that specific dedicated thing they're working on, but how they think it could be relevant in a broader frame. In the assessments we did, it was very helpful for the colleagues who were organizing the assessment in their country to also have some strategic discussions and share their views and their ideas on how things can be improved in the system. And then what's really nice about this tool is that it can be used in different areas. So now it's been designed for health information systems, but it also it works in a modular way. So there's modules that operate for digital health, for purely infectious diseases, for example. And so I think that is also quite an interesting aspect to it. And then we've that much enjoyed carrying out this exercise, and we've had so much positive feedback of the countries that were involved in this exercise that we will continue the work, but in a different perspective. Because obviously, you don't need to do a health information system assessment every year. It is something that you could repeat at a certain time. But now what we're doing is that this year and next year, we will be working on assessments looking at COVID-19 specifically. So we're looking at what is the chain of information that is flowing for COVID from the moment the data is collected until the moment it is used in the decision-making processes. What are some of the flows that is happening in this health information system in the country? And why are we doing that? It's because we want to understand in some of the countries what was the impact of COVID-19 in the health information system. Were the data sources that were there adequate, or did they have to completely change some of the aspects? Was some data not even collected, or was it in an ad hoc way? So obviously, I think all the systems had to enlarge some of the aspects that they were doing. But I think being exposed to a crisis really shows you how resilient your system is, but also how capable it is to respond to some of the questions that come up at a dedicated time. And so I'm really excited to see what will come out of that, because we want to look at what are maybe some of the gaps countries experience, but also lessons learned. And I think with COVID-19, what happened is it hit us, it hit the Koch-Institut, it hit the Sciensano, and everyone was working 24/7. And I think it's been very intense. And now what we need to we haven't had time to process things. It was just making sure that the data that was needed was there, or that we got it and that we reported on it. But what we need to do now is really look at how can we improve our health information system having faced this crisis, and what are the lessons learned that we can implement after this crisis has been, or now that the crisis has been a bit maintained, and hopefully things will slow down a little bit. So taking these lessons learned and really taking the time to look at how your system has experienced this and what can be done in order to improve it. And I think this is a time usually when people are like, oh, we're tired now. We've faced so many difficulties and we've tried to improve ourselves. But I think it really deserves the time to take a step back and really think, okay, what happened? How have we managed to take up some of the things, and what can we do in order to make our health information system stronger? So I highly recommend you to engage also with FI right there, because we want to do these assessments, and we hope that we can do this in as many member states as possible. Okay, and so I explained to you what we have done with these health information system assessments in INFACT and how they operated. And now what I want to take a bit of time on is to share with you what were some of our findings and what did we see as some common enablers and barriers in EU health information systems. So here I split them up into two categories, because one part is really about as I said earlier, like the data collection, the data infrastructure, the data management, the data analysis, the reporting tools, and the knowledge translation. And the second area is more about all the resources, all the capacity, all the elements you need in order for that first category to work. If you don't have enough of the second category, your whole first category will not be able to operate efficiently, I believe. And so what I will do now is I will go through each of these different themes covering the results that we found. So the first one is data collection and sources. And so what we see here across Europe is the most difficult thing to tackle, and I think many of us face this, is the fragmentation of data sources. And I touched upon it just earlier that, you know, the fact that these different data sources in countries are very fragmented and operates in different institutes makes it really difficult in terms of data linkage. Of course, in some country, the data linkage is quite strong because they do more of a centralized data storage. So what I call under one roof, a centralized data storage can really help you to overcome that. But obviously, historically, not all countries have had the opportunity to organize this in such a way. So I think that's one of the major struggles that we see across countries in countries is having the fact that these data sources are fragmented over different institutes makes it difficult then to link that. So both aspects of duplication, as I touched upon previously, is a consequence of that, but also in terms of continuity of care. So, for example, in Belgium, when a patient enters one hospital and then goes to another hospital and then maybe goes sees his GP, then sometimes this information of the same patient is actually not followed up. So that makes it quite difficult in terms of continuity of care. And then, of course, data collection. I think one interesting experience we've had is during COVID-19, some policymakers saying, what? You don't have this data? How come? So we tend to think that we already have everything. And in a lot of cases, it's true. So most of the health information systems we assessed across Europe had a lot of rich information. So the reuse is sometimes a bit more the struggle. But in some areas, we tend to have data gaps. For example, in Belgium, it's difficult for us to have an exact view of how many people with diabetes we have in the country. So there are some really quite rudimental areas, I would say, where sometimes data gaps still exist, even in the most developed health information systems. Then data infrastructure and e-health systems. So, of course, the fact that we are setting up electronic health record systems and e-health systems across European countries is bringing a lot of opportunity, but it also brings some threats with it together. So what we saw was, in terms of opportunities, is that it enables you to do data linkage within and outside the health sectors and involving actors. It also increases patient involvement because usually you have a platform where you have an access of the actual patient to be able to see its information. And I think also in health information in general, we tend to not that much interact with the community when you think about once the data has been collected. So having this specific dedicated section in e-health systems, I think that's quite interesting. Also, the fact that it can simplify administrative procedures, it can improve effectiveness, quality, comparability, and coverage, and it can create a transparent governance structure. What I mean with that is that when we looked at e-health system developments in some countries, the fact that they wanted to set it up and the fact that it requires intensive resource, but also strategy planning, makes the different stakeholders in the country come together. And what we've really seen is once to be able to have a very efficient implementation of your e-health system, it's really important to involve all the different providers, all the different data providers, and all the different stakeholders. One of the threats is incompatibility of the databases. And this is also something which many countries, I think, face. In Belgium, when you think about the software programs that hospitals are using or that general practitioners are using, they're so diverse. And so that makes it a bit complex to be able to include all of that. Also, some systems are still paper-based, so in terms of history and in terms of some aspects are then not included in the eHealth system. Then you need to really have a skilled staff. And of course, it's always difficult to motivate people in any health information area for them to dedicate really specific time to be able to have the best available health information. And I think especially during COVID-19 times, that was also the case. People were fighting to make sure people were being treated. The emphasis was not always that much on actually collecting the data and making sure that the governments knew exactly what the numbers were, which, I mean, is understandable given the time constraints. But of course, it is very important to be able to make decisions and to see how things evolve over time. And then two other aspects is that the legislation sometimes does not allow you for the eHealth system to be implemented and to be efficient. So there is a lack of resources in many of EU health in European countries, and also there is a threat of having this outdated legislation. And then the last point is that there can be misunderstandings. So we've gone into some countries where they were said, oh, okay, so we have this eHealth system set up now, we're good. But then there is no understanding that actually it doesn't cover registries, that disease registries are really essential as well, and that you have different areas that need to be covered and that eHealth systems don't cover everything. And this is a common misconception that is not only, I mean, that happens in a lot of the health information systems across Europe. Then when you think about data management, I split it up into three different areas. One of the most interesting areas I thought is regarding to data management procedures. And we know many countries are facing some of these struggles across Europe, meaning who's the owner of data? Who allows you to, or which organization then allows you to get access to the data? How is the linkage then done? Is it ad hoc? Is it something that is routinely happening? And so these data management procedures in many countries are not defined, which really hampers some of the research and really hampers the analysis for data processing. So yeah, and then in terms of linkage, as I said earlier, in Sciensano, for example, what we struggle with is that some of the linkage procedures for us that happen are ad hoc and they're not routinely happening. And therefore, it is difficult because every time you want to do data linkage, you need to go through the official procedure, an ethical procedure. You need to go to the data permit authorities, to the specific authorities that will allow you to get access to it. And there's always a time frame on it. So that sometimes makes it difficult. And obviously also what you need to consider is the lengthy aspect of this process. So for example, in the project we're working now in FIRI, we're looking at specific data sets that are linked to COVID-19. And yeah, we have 18 months to perform the whole project. But then at the same time, it will take us more than half of the time to actually get the permits and get the data that we need to look at. Another barrier when you talk about linkage is that the fact that a lot of the data sets are recoded or anonymized. Obviously, that's really essential and important for privacy aspects, but that does make it difficult when we think about linkage opportunities in the future. Then you have sharing data and secondary use. So here, what's really important actually is trust. And we've seen that when different institutions across Europe, across a country trust each other, this really allows for much more interaction and really allows for people to use the health information that is available and reuse the health information that is out there. So strong interinstitutional connectivity is really important. And allowing different stakeholders to access the data and giving the opportunity to access the data. Then some of the aspects I still wanted to discuss as well is dissemination and access to health information. Obviously, it's really important to share results of findings. And I think especially in health information, we tend not to be the best at doing this. We're good researchers, but we tend to be less well at reporting and making sure that we bring our messages across to build dashboards where this information can be very simply represented, or to build infographics. But I think COVID-19 has really pushed us to do that more and more. So I think we're improving, but it's definitely an area where a lot of work is needed across Europe to train our public health professionals also in becoming good at bringing these messages across. And we tend to work a lot with big reports and how some systems have been able to, for example, have all necessary information on a certain website, for example, that actually their policymakers can go to and dedicate and extract the relevant information about that. For example, the RIVM has a quite developed website where parliamentarians go to when they need to answer to specific questions. So I think that's something also to flag as an important area. Then we have knowledge translation. For knowledge translation, what we see is that this is often an under invested area. So this is something also we could focus more into health information systems across Europe. Then when I go to the second block of resources, human resources is a challenge for everyone, regardless in which system you work. So, or which country you work, I mean. It's difficult to attract and retain staff. Sometimes there's a lack of specialists, and there's professional training needs available. And I think when we talk about the future, in the future, in health information, we will be more and more working with data hubs. So specific health data hubs. And for this, you don't only need people who know the databases, but you also need specific skills that allow you to move data sets between countries, to set up safe spaces where you can analyze data that comes from different areas, not only your institute, not only within your country, but also across countries. And this is a newly, I would say, evolving area, which has not been worked that much on the past in. And especially with the European health data space coming up, there will be more and more a push into countries to also develop this specific expertise in countries. And in Belgium, for example, with Sciensano, we've been trying to find a data engineers to get and develop this expertise for the future. And we've really struggled because a lot of the data engineers end up going to big companies where they get paid much more than, for example, in a public health institute. So this is really an important area to consider. And then obviously the infrastructure underlying all of these things are very important. Some countries are experiencing also shortages with regards to investing in this specific technical infrastructure. And also here, there's really a difference in terms of distribution. And in Germany, for example, you have the lenders. So a lot of the areas I'm covering will also be applicable to making sure the resources are available at all levels, because in Germany, for example, the regional level has a really strong play. Then I will go to political elements. The political elements is huge. It really cannot be underestimated. So if you have political will and leadership in the country, it can make a very big difference in how your health information system will operate. Because health information did not used to be, I would say, a sexy topic. Before, monitoring requires a lot of investments in countries. And politicians tend to say, I want to get an answer on a specific topic now. But if you want to see how population health evolves over time, you need to invest a lot of money over a long time. And yeah, therefore the political setting is really important. However, the political setting can really boost things. So if there's close relationship and trust between researchers and policymakers, and this interconnectedness is really important to directly streamline some of the outputs that health information systems are producing in countries. And then, as I said previously, having a coordination mechanism in your country that brings together the stakeholders, that brings together the different partners that are essential to your health information system can really boost and optimize the working of your health information system. So one of the challenges there is instability, unclear role, and also this unequal attention that is given between healthcare and public health is important. And also policymakers sometimes tend to completely misunderstand or are unaware of some health information elements that are available in the countries. And then my last theme is financial and LC considerations. So in health information, sometimes projects tend to be financed project-based. So for example, European projects tend to be project-based, but there's a real danger to that, because once the project is stopped, then the expertise will leave, obviously. And for example, in Sciensano, we do a food consumption survey once every 4 years, but then the person works on it for a year, then leaves, and then we need to completely start from scratch well, not completely start from scratch, obviously, we build on some that's already done, but then the new person who follows up needs to build up the expertise. And then privacy and ethics. One of the major hurdles across Europe, and I think many countries are facing that, is the GDPR. So the General Data Protection Regulation has been interpreted differently in countries, has had different implementation in countries. And this has really had an impact on the field, I would say, for health information, because some people were actually afraid to share data, because for GDPR reasons, the one who has collected the data is responsible for every single output that is produced from it. And once you give it away to another partner, if then this person does something with it, you're still the main responsible one. So there is I would say, quite some fear that is linked to the GDPR, and the interpretation has widely differed from one country to the other in the area of health information. So as I said, it can lead to misunderstanding, misinterpretation, and therefore limited data usage and data networking. And also, still some countries need to implement some amendments to the GDPR because it has sometimes it's just a specific article that has been implemented after making it mandatory in 2018 for its implementation. But some fine-tuning is still necessary in some of the legislation that is existing. And of course, it takes a lot of time to amend legislation and to be able to do that. So overall, looking at all these different areas, what some of our findings was that really every health information system is unique. And maybe that sounds logical, but sometimes we thought, oh, we're going into this very developed health information system and it will be perfect. But then you realize that really there are strengths and weaknesses regardless of like how evolved the system was. So what may be perceived as a less evolved health information system, when we went in there, we saw that they had really some unique things that actually more developed health information systems could learn from. So sometimes we tend to think, why should I invest in Europe, and why should I participate in like European initiatives when I have such a strong system? Well, actually, you really still get to learn a lot. As I said before, by being exposed to another one, you understand your own system better, but also it can still give you ideas of some things that you can improve, which is happening in other systems. Then our second finding is that often the same barriers and enablers appeared across the different countries, which I just showed to you before. And barriers were identified in all areas of health information systems. So not only in the area of data collection, but also in its interpretation, its reporting, in its knowledge translation, in the political and the legal system, or with regards to the human, technical, or financial resources. And so I just summarized very shortly the barriers here. The main barriers are fragmentation of data sources, limited accessibility, use and reuse of data, barriers in the implementation of the electronic health record system, governance issues related to unclear responsibilities, discontinuous financing, or weak intra and intersectoral collaboration, legal gaps and GDPR, between brackets, misinterpretation, and limited skilled staff. Okay, and that brings me to the last big block of the presentation. I think I still have 10 minutes left. Is that correct, Jürgen? Okay, great.
Yes, please.
Okay, perfect. All right, so here we go. I just wanted to touch upon some of the big strategic initiatives that you might want to know about at European level. So there are many, and we don't have time today to talk about all of them. So I will just touch upon 3, and I will mention a few others. The one I want to mention to you today is a European health data space, because I think it will have huge impact into the future, also specifically on the work the Robert Koch Institute is doing and any other public health institute operating at European level. And then towards the European Health Data Space, which is a joint action, which is providing options to what the European Health Data Space could do in the future. And then I will talk about our project that we're working on, the Population Health Information Research Infrastructures. Okay, so what is European Health Data Space? And I think for many of us, it's a little bit difficult to still capture what it is, because the concept is currently being developed also at European level. However, there is huge interest in it. And van der Leyen has mentioned it in several of her interventions, and the commission letter from Kyriakides, which is the current commissioner on health, has specifically mentioned it as well. And so the commission will provide substantial resources to further invest in this and develop this in the future. What is it? So the purpose of the European Health Data Space is to have better healthcare, better policy making, better research and innovation. And it is built on 3 pillars: data governance and rules, data quality and interoperability, and infrastructure and technology. And it will really build on national competent authorities, meaning that for the moment, how the European Health Data Space is being designed is that what it wants to do is it wants to facilitate 2 main areas. The first area is the use of health data. So the primary use of health data, making sure that electronic health records in different countries can be followed up for or can be made operational cross-border. And the second area is the reuse of health data. So making sure that data that is collected across Europe can be used in other circumstances for better policymaking, better research, and better innovation. So we call this European Health Data Space 1 for using health data for primary purposes, and secondary use, and European Health Data Space 2 for the reuse of health data. And I've been mostly involved into the discussions for the second part, so for the reuse of health data. And I think what's important here for the Robert Koch Institute is what they want is that each country has a single data permit authority, so that there's one organization in the country that receives questions from the European community, and that they search and broadcast the question into the different institutes, into the countries, that then scope how they can answer it, potentially say how they can answer it, and provide a space where then this person can look and analyze the data and get the results, or broadcast it back if it is something that it can be publicly shared or is findable in a GDPR compliant way. And what's really important is that each country will need to look into the future how we organize ourselves. So strategically, what we've been doing in Belgium is to think about how can we build a health data authority, a health data hub in Belgium. And I know also in Germany, there's a tendency to move into that direction, but I think that will be extremely important for what is coming up in Europe. So what is TEDAS? TEDAS is a joint action that started in February this year. I'll be running for 2 years and a half. And basically what they're doing is they're developing and promoting concept for sharing data and secondary use for purposes. For example, they look at the citizens' health, public health, as well as health research innovation in Europe. But just to translate that for you, what that means is TEDAS is currently looking at options of what the European health data space could be in terms of how it is governed, in terms of how patients should have access to their data or not have access to their data, or how all these privacy issues should be managed and should be secured and ensured. It also looks at the technical infrastructure that needs to be set up, or what are some of the options for the setting up of a technical infrastructure. And it looks at semantic interoperability. So in terms of data quality, what kind of standards should we set? How can it all operate in the European health data space? And there is much more that's coming in the future, because what they will do is they will decide what the European health data space, they're going to pilot it. So keep an eye if you're interested in this. There are calls coming up where consortiums will be formed in piloting the European health data space. And so, as I said, some of the areas they cover is governance, data quality, infrastructure, citizen engagement, data altruism, and sustainability. Then I'll shortly talk about FIRI. So what the European health data space has as vision, which the vision is really to facilitate health data exchange across Europe. FIRI focuses on one specific area, being population health, and how we can support the exchange and facilitate the interaction and best practices in the area of population health in COVID-19. And so what we're looking at is that the direct and the indirect effects of COVID-19 on population health. And how are we doing that? Well, we're building a federated infrastructure, meaning we're building the technology which allows you to have data sets in different countries, look at similar research questions, and answer to them directly. And how is that different from the European health data space? Well, the European health data space is not actually helping the countries on the spot to develop the technology to allow the response. They're just going to say, this is the question. So FIRI is taking it a step further, looking at the question and providing the answer. We're also working on a portal, which I'll show in a minute. We work on responding to some of the rapid exchange questions, so questions that are coming from countries, and we're working on foresight modeling and scenario building. So what we are providing is we are building a health information portal. It's a one-stop shop, which would actually help to facilitate the work that you are doing in your country. So more specifically, if you're looking for any type of data source in health information, you would not need to go to every individual country and Google every individual database that is available in the country. What we aim to do is to provide an overview in each country. What are the major data sources? Who are the major ones that are managing this? How can I get access to it? The second thing is we also want to give information on different projects, initiatives, research networks that are operating across Europe that are relevant for health information. And one of the important activities that we are doing with FIRI is to really support these national nodes, as described earlier, bringing together the different stakeholders in the country and already giving them a task of like, fill in this portal so that at least you get to talk with the different stakeholders in your country to provide the available information. And what will come in the near future is we're working on training and capacity building in all areas of population. We're building on toolbox for legal and ethical guidelines, and we're providing overview of reports, guidelines, articles, and publications that are relevant for COVID-19. With regards to the Rapid Exchange Forum, this I would really invite you to participate in this. If with the Koch-Institut you have a COVID-19 specific question, you're saying we have a question about long COVID and how is that being dealt with in other countries. What we're doing in that specific network is we're broadcasting this question across our network, and we're able to receive questions in a very, very short time. So for example, last week the ministry asked me, what is the stage of vaccination in countries with regards to patients with comorbidities, or like the population with comorbidities? And so thanks to this network, we've been able to respond to that question very quickly, and we've been able to support our policymakers in providing the answers needed. So here again, a shout out, if you have any questions that you think are research questions or methodology questions with regards to COVID-19, reach out to us. And then my last final slides are about infodemic management. And why do I want to talk about that today? It's because our society is evolving, and many of the discussions are now more and more taking place in virtual spaces. And there is a lot of information going around, and this has a direct impact on the work that we're doing in public health institutes. I remember during the COVID-19 crisis, for example, that the Robert Koch Institute had some sort of threats. We have experienced this with Sciensano as well. And I think in the future, and even, well, not in the future, I think now, it is important for us also to learn how to deal with that type of information that is spreading among society, because we as scientists know the facts. We as scientists have a role to play in this, and it's important to know that we're not alone. That if you want to address infodemic, you need to work with journalists in your country. You need to work with NGOs. You need to work with different types of organizations that can really support you in dealing with this overabundance of information that is being shared among society, and that has it can be both correct but also wrong information, and how this has an impact on the health of your population, and also has an impact on the work that you're doing with regards to health information and public health surveillance in your country. And so my two final slides are just to show what are some of the methods that you can do, and what are some of the frameworks that have very recently been created. So all credit to the WHO for these slides, as I've taken this from some of their work. But what's really important here is to prepare and monitor, to detect and understand, to respond and deploy, so to intervene, and then to strengthen resilience. So there, for infodemic management, there are very specific steps that you can undertake in order to address this. And very often, or like now during the COVID-19, the epidemic and infodemic actually come together. And it's important for us to also deal with the health information that is being spread among the population. And one of the core things about public infodemic management is social listening. And this is some of the skills that we do not have yet in public health institutes, but especially in the, I think now with COVID-19, but more and more also in the future, will be some of the essential skills that we will need to build up. So what we're doing with FireEye is we're providing workshops, but you can also see that the WHO is more and more investing in this as well. And I would highly recommend also our different public health institutes to invest in this as well in the future. So there's much more I can say about this, but I will keep it at that, and I'll be very happy to take any questions that you may have. And thank you so much for having me today and being able to share some of the experiences we have seen across Europe. Here's my email address. Oh, there's a typo, sorry. In my email address, it's obviously the same name. So the R and the T need to be reversed. And you have also my cell phone number if anybody has any questions. Thank you so much. Over to you, Jürgen.
Thank you very much, Petronille. This was a very interesting and informative presentation. Impressive to see also which progress the whole issue of health information on the European level has made. I've worked on that also for a couple of years, and my congratulations on that, and impressive to see.
Thank you so much.
Well, now looking on the number of questions that are coming in from the chat. because I could easily have one on myself, because having seen some of the problems or encountered the same problems like you maybe in your actual work, was also the work between the interrelation between the international stakeholders. And there we also already ran in the thematic of duplication of work, avoiding similar work. And are there new platforms or are there new ways of exchange between the international stakeholders to get into contact and to avoid this kind of additional work or duplication of work?
Yeah, thank you so much for that question, Jürgen. And I think especially with if you talk about international organizations, I think it's our role as member states to really point at that to the European Commission, to international organizations like the WHO and OECD, because obviously they talk to each other and a lot is happening. But for example, when a crisis like COVID-19 hit, everyone was like, what are we going to do? And everybody wanted to do something, and everybody had to do different areas. And when something like this happens, you have the danger of initiative popping up like mushrooms, going to all different initiatives happening across Europe, and this danger of duplication. So some of the things that we've been trying also with FIRI is to actually have some of these stakeholders come together and speak to each other. But I think it's a responsibility for all of us as member states, when we are engaging into some of the discussions that they're organizing for us, to keep our ears out and say, or to be attentive. Like, oh, I've heard this before and somebody else is working on it, so that we also point to them and also point to ourselves in our institutes, in our daily work, like, oh, wait, my colleague is doing that. And I think the fact that things are virtual has two sides of the medal. One side is that it's great because we get to interact so much quicker, and we tend to, before we never thought that we would have so like strategic meetings like virtual, and now we're so used to having them. So it's really nice that that interaction is happening. But at the same time, there's an overflow, and we tend to also get overwhelmed with the amount of meetings. We tend to be overwhelmed with the amount of information that is available. So it's very important to, try to also work with that. And also, one last thing maybe that I want to mention is corridor talks. So sometimes when you're in an official WHO meeting, it's a bit difficult to say, oh, maybe what you're doing, I've seen it somewhere else. And so when we were having physical meetings, it was sometimes easier to have these corridor talks where you can point to certain areas without being politically sensitive about something that you're saying. So hopefully in the future, we will be able to work in these ways as well.
Yeah, I think that will be quite important. And maybe Thomas, you can also, would you have a question for Petronille?
First of all, thank you very much for this very much food for thought. I think so many dimensions of public health information systems, and you pointed out so many opportunities and challenges, which is, I have to go through this again. It was quite interesting. One thing I would like to ask, you mentioned the self-assessment with a tool of WHO, and that one of the outcomes was, well, just to get aware that we are part of a system, which wasn't there. And I think that's maybe true. This is related to the silos. And the next step then would be, if I'm aware I'm part of the system and not only part of an institute, how do I connect and how do I optimize the information and workflows? Mm-hmm. Do you happen to know one example where this evaluation led to changes or action or
yes
insight?
So we've actually had a few, but I think the changes aren't always so explicit, but the fact that people get to know each other, and then whenever they're working on something, because the assessment happened, they've met some of the people they weren't familiar with before. They can just pick up the phone and say, oh, I'm dealing with this now. Have you already looked at it? Or do you have some ideas? And that's just a small example. But I think in a bigger chain, some of these small difference can really have a bigger impact, especially in the areas where I was saying, you know, having trust between partners of sharing certain types of data sets, on the procedures on how to do that. I think when major institutions also have trust between each other, you always trust someone more when it is a person you know.
Right.
So I think that's really, really, really important. And that's something I fear has been missed in the past 2 years with working virtual. So I really hope that we stay human, even though we have worked so much more and more virtual, but we stay human, and we like keep the this importance of exchanging with each other as persons. So I think we need to be conscious of that. But some of the other changes with the health information system that happened after the assessment is major funding, for example, that the ministry realized, oh, okay, this specific section is underfunded. And I got to talk to some of my colleagues, and many of them are now connected, and we do think we need to reinvest more. So maybe not directly in the sense that before it would be no funding and after it would be, but for example, a call that was already in process, and then the fact that, you know, they get to see some of the issue, some of the things, they put it on top of their agenda. Let's put it in that way.
Hey, yeah, quite interesting. Thank you very much for this. And may I put, we are running out of time, but may I put another question, a quick one. You mentioned there's one regulation for data privacy, and it's interpreted differently, which is causing lots of problems. And is there any initiative, well, on the way or planned, that looks at those different interpretations and pushes forward to better harmonization?
Yeah, so the GDPR, the General Data Protection Regulation, indeed has led to a different implementation in the countries. But the thing is, the GDPR covers all data. So it's not only health specific rights. There are some exemptions in terms of for research or public health purposes that the GDPR does not cover or allows for. So definitely there has been a different interpretation from different countries on how to look at these exemptions and how they've been implemented in countries. So one major study, which I would recommend you to look at, and I can pop it in the chat if I have a second to Google it and forward it to you, is a study has been commissioned by the European Commission to the Institute in the Netherlands. And what they did is they set together with stakeholders, data protection officers from a lot of different countries, and they looked indeed at, you know, how it has been interpreted differently, what was some of the impact, and they actually have an evaluation sheet for each of the different countries on these different implementations. So the Commission has looked thoroughly at that, but one with a caveat, if I may say, it's an excellent study, but again, sometimes the focus tends to go to primary data, so clinical data, and sometimes what's lacking a little bit is the other types of data, like registry data or more public health types of data, which are different people having the expertise, and they were not invited into these stakeholder groups. So I think that perspective is still a bit missing. And we try to, in fact, we've looked a little bit at that, but I'm not confident. There are a lot of more projects that are specifically looking in the area of public health and reuse of data on the impact of GDPR, although the TEDAS Joint Action has also a few tasks that are looking at that more specifically.
Okay. Interesting. Thank you very much.
Okay, so, and I would also like to thank you, Petronille, for this very inspiring talk. And with today's lecture, we are closing the Robert Koch Colloquium 2021, and we will search for a new theme for next year. And just because you have mentioned infodemics, and only today we had a talk in our science communication team within the Institute how to address this issue, and I'm sure they will also reach out to you after having heard that European initiatives are also working on that. So I think that will also be food for thought for them. And thank you very much.
We're
And
very,
so
very happy to support you there. So if you have any questions, so we organized a workshop on this, and what we did is we screened the entire European landscape at the moment to see who are the main speakers or the main people in Europe working on infodemic management at the moment. So we're happy to help you out if we can give you any suggestions. Thank you so much again for having me today, and I very much appreciate it. Thank you.
And I would also like to thank the audience, and then we will close today's lecture. Bye-bye to everybody.
Thank you so much, Thomas, and bye, Jürgen. Thank you.
Bye.